We're approaching 2 years since New York State's medical marijuana bill was signed into law. The program didn't actually roll out, though, until January.
We wanted to know how it's going. So News 4's Jen Shant spoke to several local families who rely on this medicine for their sick children. Jen?
Well, Don and Jackie, compared to other states' medical marijuana programs, New York's was implemented rather quickly. But people who rely on it say there are still so many kinks that need to be ironed out here, starting with keeping dispensaries open, affordable, and stocked with the products that people need.
We're lucky that we have product to choose from, but we don't have the right product. We don't have enough product. The product keeps changing. Prices are fluctuating. It still has a lot of work that needs to be done.
Patty and Buck Williams were thrilled when they learned New York State was going to provide life-changing medicine for their son, Tommy, who suffers from severe epilepsy. Like many families in their situation, they hoped the Compassionate Care Act would be a turning point to dozens of seizures a day. They've tried everything: alternative treatments, a long list of pharmaceuticals, even moving out of the state to get access to medical marijuana. Nothing was a permanent fix. In July of 2014, the Compassionate Care Act was signed into law. The program was actually rolled out 18 months later with an online registry through the Department of Health.
The main thing is that you could get through to the people, and they were friendly and tried to be helpful, but the problem was a lot of them had no idea what was going on. So they're still learning and figuring it out as they go.
There are about 600 physicians in the state who can prescribe medical marijuana. More than 5,000 patients have been certified to receive the drug. According to a Department of Health spokesperson, the wait time between finding a certified doctor and registering as a patient has been cut down by 50% since the program started. But patients tell us finding physicians hasn't gotten any easier.
Luckily for me, I knew people that have gone before us, because if I didn't, I would have had nowhere to go. I wouldn't have known where to turn.
According to a DOH official, quote, the majority of registered physicians do not want to be listed publicly, in part due to safety concerns, because criminals may mistakenly believe that marijuana plants or products are stored at the doctor's office, or that large amounts of cash are on hand. There's currently a secure portal through the Department of Health. It allows all certified medical professionals licensed to treat illnesses within the medical marijuana program access to one another, but patients aren't able to see it.
It's just frustrating that certain states can just go to a dispensary and get anything that they need. New York State, we really had to fight for this. We would go to another state to get it if it was legal.
Here in Erie County, there are 2 dispensaries for medical marijuana. One of them, Bloomfield Industries in Williamsville, recently cut its hours. While you can schedule appointments any day of the week, it's now only regularly open 3 days a week. Public health advocacy groups say that's a red flag. Like these 4 families, the Drug Policy Alliance says transparency is a problem within the DOH. They say they've had a hard time getting specific answers to their questions. The DPA recently published a report detailing concerns from patients and caregivers. Of the 255 they interviewed, 77% who had obtained medicine said they wouldn't be able to afford it. At one point, the Williams were facing a $2,000 a month tab for Tommy's medicine. The Commissioner of Health approved prices set by the 5 registered companies that operate the state's 17 dispensaries. Because it's not federally approved, medical marijuana is not covered by insurance. According to the DOH, there's a discount for patients in financial need, but it's only between 8 and 15%.
Since I've started my children on this product, the concentration has changed 5 times.
Daniel Rishka is a pharmacist and a father of 2 kids who rely on medical marijuana to treat their symptoms. He feels there's not enough consistency in what his children are being given. The DOH official says all products in the state's medical marijuana program are tested at a state lab, and that with an agricultural process like this, certain products require more tests and are subject to change.
It's you're driving with your headlights off. You don't really know what the response is going to be. You're just trusting that the child responds appropriately.
Parents like Lisa Valley, Christy Maxon, and the Williams share Rishka's frustrations.
They become our best friends. we're all in this together, and we're a big family. We lean on each other when times are tough. We support each other, and we're a great resource.
Valley and Rishka have teamed up to help other parents in our area understand the state's program. Essentially, they're doing the job they say the state isn't. They're getting answers and spreading awareness.
This is beyond our children. This topic is a worldwide issue that is taking a deaf ear.
Valley's daughter, Maya, has come leaps and bounds since getting access to medical marijuana. As frustrating as the state's lack of response to her concerns has been, she remembers what life was like before medical marijuana was even an option.
It's like literally putting your child on railroad tracks and hoping a train doesn't come by today. I mean, that's how scary it is every single day.
Now, there are currently a few bills pending in Albany aimed at improving the state's medical marijuana program. One of them would add more producers and dispensaries around the state. Included in the state's medical marijuana bill is a requirement that it publishes a report on the program every 2 years. The first one, well, that's coming up next week. Reporting live in the studio tonight, Jen Shantz, News 4 at 6.